So you have high blood pressure. Is your high blood pressure being treated optimally? And I don't just mean to an optimal number. I mean, are drugs for high blood pressure the optimal treatment for you? I'm Miles Hassell. I'm an internist in private practice at St. Vincent Hospital in Portland, Oregon. And I'd like to talk a little bit about the alternatives to high blood pressure drugs and why you might want to pursue them. So the background is that high blood pressure causes brain damage, increases your risk of stroke. It causes heart damage, including the risk of heart failure and heart attacks. It can cause kidney damage, leading to dialysis. High blood pressure does a lot of bad things. So we need to do something about it. And high blood pressure drugs are a whole lot better than nothing. But what if you had something better than high blood pressure drugs? So for the vast majority of people with high blood pressure, they have a problem that we call essential hypertension. And for most of them, they don't need to be on blood pressure drugs if they do other things in their life that we'll touch on in a second. The reason why this is important is because high blood pressure drugs come with a cost, they come with side effects, and they do not reduce your risk of stroke to normal. So in something called the REGARD study, for example, when people who were on high blood pressure drugs had their blood pressure perfectly treated, and they were compared to people who were not on blood pressure drugs with that same blood pressure, then the risk of stroke in the people on high blood pressure drugs was between 2 and 3 times higher than the risk of stroke in the people who were on no blood pressure drugs with the same degree of blood pressure control. The second reason to think about this is that high blood pressure drugs are associated with more white matter hyperintensities. You may not have heard of white matter hyperintensities, but your brain has, because they're associated with aging, high blood pressure, diabetes, smoking, things like that. And they are predictive of things like dementia. You probably don't want to hear that. So if high blood pressure drugs are not going to reduce your risk of stroke to normal, and they are associated with more white matter hyperintensities, which are bad things to have in the brain, what else could you do? Well, the answer is pretty straightforward. For the majority of people, not everybody, but the majority of people, if they improve their fitness, typically with us, that's an exercise program once or twice a day, improve their diet quality and their diet quantity, reducing their waistline, then in most cases we can get their blood pressure perfectly treated without high blood pressure drugs. And that is not to say that we recommend just stopping your blood pressure drugs. That would be dumb. What we recommend is you incorporate lifestyle in a systematic, thoughtful fashion, treating it as if it's a prescription. Bring down your high blood pressure, gradually get rid of the blood pressure drugs, and enjoy a better life in the long run. A better life in the long run, because as we bring your blood pressure in control, almost always cholesterol improves, well-being improves, blood sugar improves, you look better. People comment frequently, wow, I haven't felt this good for 20 or 30 years. That's a good thing. How do you get information on this? There's many people who talk about this. We sometimes call it grandmother medicine, eat greens. And we have information on it in our book, Good Food, Great Medicine. We have a free handout on our website. The website is also called Good Food, Great Medicine, oddly enough. And there's a free handout that walks you through the kinds of things that can work. And of course, we have a private practice in Portland, Oregon, should you wish. But wrap your mind around the fact that the things your body can do for you are better than anything doctors like me can do for you. Thank you.